Welcome, everyone. So thank you for being here. My name is Lauren Williams. I'm Adult and Community Services Manager for the Columbia Public Library, which is part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn. Today's program on the topic of paid family leave is co-hosted by the library and the League of Women Voters of Columbia Boone County. And before I turn things over to the League to introduce our speakers, I have just a couple of very familiar Zoom housekeeping items at this point. To ask questions of our presenters today, as usual, we'll be using the chat feature of Zoom. So if you hover over your Zoom window with your mouse, you should see the chat icon. It looks like a speech bubble, and other tools at the bottom of your screen if you're using a computer. If you're on a tablet or a smartphone, you may have to tap in the middle of your screen to get those tools to appear. But see that chat bubble, select it, and then you can type in your question. We are recording this presentation, so it will be available in the next day or two on both the League's YouTube channel and the library's YouTube channel for future viewing. And now I'd like to welcome our moderator, League of Women Voters of Missouri President Marilyn McLeod.
Good afternoon, and welcome to everyone who is attending this afternoon. I'm so glad that you are here and interested in this very important topic and very much in the news topic. Paid leave is one of those things, if you are working and you have a job that offers paid leave for sick leave or vacation leave, you don't worry about it. But there are so many people, and there may be people in your own family who do not have this benefit. And if there's any illness or need to take care of someone in your family and you don't have that ability, what do you do? Well, the League of Women Voters is very interested in this topic. One of the things I wanted to share with you is that the League, if you are familiar with it, you may think, oh, those are the folks, the ladies usually, who do voter registration, who are out there encouraging people to vote, who work on voter protection. But we also are very interested in what we call public policies. And that has been as long as the League has existed, which is for now over 100 years, that there are issues that come up in our society that the members of the League are very interested in, and they want to see action in some way to make life better for citizens. We are a nonpartisan organization. We don't endorse any party or any candidates. The issues that we take up are purely on the basis of what those issues are. So today we're going to talk about paid family leave, and we are delighted to have guest speakers from the League of Women Voters of Kansas City and surrounding counties. There's several counties involved in that league, and they have been studying this issue and are sharing what they have learned and offering it to us, both to our League members and to the community. So I will introduce Alice Kitchen, who is the chair of the committee. She will speak, and also we have guest speaker, member of that committee, Judy Ansell, who will share, and they will share information about their backgrounds and how they came to do this study. And thank you, Lauren. I don't know if I thanked you properly. Thank you for working on this with us and for the library. We are always so appreciative. Okay, I'll turn it over to Alice.
All right, Judy, why don't you give your background first, and then I will give mine, and then go into the preface of the meeting.
Thanks, Alice. So my name is Judy Ansell. I get to do the PowerPoint because I'm professionally a teacher. I retired a couple of years ago from UMKC. I ran their labor education program for 29 years and have worked with unions as well as students for longer than that. I was once a member of the United Steelworkers Union and worked in factories. And I've also been a member of the American Federation of Teachers. And in all of that work, I have been very conscious of the fact that workers, and particularly women workers, need more benefits. And one of them is that we need to have better paid sick leave, and we need to have some kind of paid family leave that allows us to care for our families as well as our employers. And so when the League of Women Voters in Kansas City started working on the issue of paid leave. And Alice invited me to be part of that study group. I jumped on it because I think it's so important, and workers in Missouri of all levels have great needs for better public policy than what we've got right now. So it's with enthusiasm that not only did I participate in the study, but I also have been working across the state in these kinds of presentations in order to get more members of the league involved. And Alice will talk about why we're doing this herself. Is that enough, Alice?
Yeah, that's good. That's good.
Okay.
My name's Alice Kitchen. I chair the Kansas City Public Policy, rather our paid leave study, and am chair of the AAUW Public Policy Committee. A little background is that I'm a social advocate, activist. I am adjunct at UMKC. I have social work students that keep me current and alive, and I'm a member of Stand Up Kansas City, so I work with fast food workers, which really is the point for which I can tell so many stories about real people's experience and not having paid leave and not having a schedule, and all the discriminatory practices that go on in the service industry. I also am a trustee on a tax commission where we distribute public property tax money to mental health agencies, among others. And I'm founder and member of the Women's Equality Coalition here in Kansas City. So our study, the reason we're here to make this presentation is that when we took our study to our statewide spring convention, the members of the convention said, okay, that's important. Take it to all the local leagues and make your presentation and come back at the next convention, and we will see if we can take a statewide position that all the leagues will concur. So that's why we're here and we're finishing up. This is the 14th presentation. And so our study took 9 months. We started in 2020. We made a report, and it's 14 pages, 2 of which are bibliography. And the point was to make the case for paid leave. And the title is The Need for Paid Leave in Missouri. We were able to secure the Missouri Foundation on Health willingness to fund the need for paid leave for Missouri workers. And they contracted with you in Columbia, the MU Institute for Public Policy, and they are doing the research, and that research on that data need that we have will be out in the spring of 2022. So what you know is that it's in the news all the time now, and the infrastructure bill passed without paid leave in it. Our purpose in doing our work is to make sure Missouri people, Missouri workers are aware of this and how important it is. We do not expect or plan to introduce this to the General Assembly in Missouri. That was tried in 2018 by a representative, Tracy McGreary in St. Louis, and they put a large fiscal note on it, killed it, and it did not reach a committee hearing. So that's not the avenue for action. If there's any action in the future, it will not be soon, and it would be through a citizen ballot initiative. And that has to be preserved, and we hope the league will strongly support all of that. So you'll find in Judy's presentation that we are not coming out making a particular model preference. We're talking about the models, but we're not proposing one model that will fit all. So Judy, your turn.
Okay, well, thanks, Alice. And so I have a PowerPoint, of course, I'm a teacher, right? And I'm going to share that and use it basically to help illustrate what I'm talking about. Come on, there we go. You all see that? Yep.
Yeah.
Okay. Okay. So actually I have the wrong date on here. I just noticed that. It's from a previous presentation, so sorry. Anyway, so Alice gave some of the background. We began in June 2020, and I'll tell you a little story. We started as a group to study, what was it, Alice? Minimum wage? No, no, it wasn't minimum wage. It
Living
was
wage, a
living wage. Yeah, we wanted to study living wage in Missouri, and we very quickly discovered that our state legislature has preempted all cities from passing a living wage ordinances. And so we quickly abandoned that and decided, well, paid leave is really a big issue. And we would look at it on a statewide basis, our cities can't pass paid leave. They're prohibited. They can do it for their employees, but they couldn't pass a mandate that employers in their cities have paid leave. It would have to be done on a statewide basis. So we began to study that for the state of Missouri. And as Alice said, we published the study in 2020, in December of 2020. And it was endorsed by the Kansas City League in June of 2021, and subsequently a number of others. So let's start with some definitions. Generally in this country, they divide paid sick leave from paid family leave. But in the 1990s, 93, yeah, Family and Medical Leave Act, which was unpaid, they lumped them together to some extent. But generally paid sick leave is an employer option. Employers do that for their employees. So it covers paid time off when the employee herself is sick. Sometimes it covers sick kids. Sometimes they don't call it sick leave, they just call it leave, and you can take it for other kinds of things. Very often it's earned, meaning the employer gives so many days per year, depending on seniority at that place of employment. And employers are often discouraged from using it. Even though, and I've talked to so many workers who say, oh yeah, I've got an accumulated 50 days of sick leave, but they don't want me to use it. And I don't know what'll happen if I actually try to use it when I'm sick. So we have sick leave for a number of employees, and probably many of you in the audience have worked at places where you do have paid sick leave. But we'll get back to how many people don't in a minute. And then there's paid family and medical leave, which is similar to what the FMLA covers, but of course it would be with pay. And that allows so many weeks for parents for the birth or adoption or fostering of a new child, for an employee and close, and for the employee's own serious medical condition, or for a close family member's serious medical condition. And I would add that FMLA only kicks in after you've been sick for 3 days, if it's your own medical condition. And there's a whole list of things that are covered, and then everything else is excluded. So you can't get FMLA, for instance, for a cold, but you can get it for diabetes. So often chronic conditions are covered, or serious illnesses or hospitalization, stuff like that. And a paid family leave plan proposes varieties of ways to pay for it. We'll get into that later. So our group, just to give some credit here, our group included the people you see on this list, and some ex officio members who are officers in the local League of Women Voters. So there's some good news, which is in terms of paid sick leave, which is that it has become more common in recent years. And this graph shows you the share of workers who actually have some kind of paid sick leave in their workplaces. So it's gone up since 2010 from 67% to 2019 to 76% of workers have at least 1 day of paid sick leave. Okay, but the bad news is that the lower wage workers are the least likely to have paid sick leave. So for instance, your typical McDonald's worker doesn't have paid sick leave. but your typical professional worker will, or state employee. I bet, the workers at the Columbia Library probably have paid sick leave. But, you go out for lunch and that waitress in the restaurant will not have any kind of paid sick leave. And in fact, 24% of US civilian workers, or 33.6 million people, do not have access to paid sick leave. And so what does that mean? Let's just imagine that McDonald's worker. She may be a single mother. Her kid gets sick. She has no paid sick leave. She is probably going to send that kid, if it's a school age kid, to school sick, because she cannot afford to take a day off. And so, the results of not having paid sick leave is that other kids get sick, or if she's sick herself and goes to work sick, maybe even the customers do. But that's not the concern of McDonald's. But it is the concern of all the rest of us. So this graph shows you what happens by income group in terms of having paid sick leave. And as you see, the lowest 10% of wage workers are the least likely, and then going up the scale. Even fewer workers have access to paid family leave. In other words, paid leave for your family member's sicknesses, or for the birth or adoption or fostering of a new child. It's a real privilege. So this shows you again by income group what percentage of workers have paid family leave at this point. And you'll see that even in the highest paid workers, there's still a huge number of people who do not have it. And this is something that you'll find out is very, very popular. People want this. The COVID epidemic, of course, created a real crisis in as far as paid leave is concerned, whether it's sick leave or family leave. What we found out that women and people of color and those of lower socioeconomic status were the most likely among all workers to hold frontline positions, the so-called essential worker positions that require in-person work, and they were the least likely people to have paid sick leave. And so, we had some government measures that were temporary, that at least paid workers for large employers to take time off when they got COVID. But I've talked to a lot of workers who work in frontline positions who got COVID and were not paid because when they had to take 2 weeks off to get better from COVID. Women have been disproportionately affected by job loss, and the caregiving burdens arising from school and care provider closures, school closures, and daycare closures, with consequences for their career opportunities, economic security, and mental health. And this has been widely talked about in the media, the number of women who had to quit their jobs in order to take care of children as a result of COVID, who will have a hard time and great losses in getting back into the labor market once the whole now the schools have opened and so on. And this has contributed, of course, to the quote, labor shortage that we read about so much, even though my own view is that we don't have a labor shortage, we have a shortage of good paying jobs in this country. But anyway, that's another issue. So the US is a real outlier in all of this. In this map, which I just grabbed from the New York Times, shows paid family leave for mothers, just for women. Okay, and you'll see in the bright orange, who is bright orange? It's the US, and it is, what is that? Papua New Guinea. Yeah. Otherwise, like every other country, I think there's one in Africa, the former Swaziland, that has no paid leave for mothers, or that may be sick leave. That may be the sick leave one. Anyway, what we see is that most countries have some form of paid leave for mothers, at minimum 4 weeks to 12 weeks. And in fact, of the 186 countries that offer paid leave for new mothers, oh, that's it. That's the Swaziland. Eswatini, they changed their name, offers fewer than 4 weeks. But that's what is now in the budget bill in Congress. And of course, you've heard in the news that the budget reconciliation bill, this is where all these benefits are, like more daycare, and used to be free college was in there, and paid family leave, family and medical leave are in there. But, it just got cut back to 4 weeks as opposed to 12 weeks of paid leave. And I mean, every study says that 4 weeks is not enough. And virtually every country in the world agrees that 4 weeks is not enough. And they give more, but that's what's being proposed right now in the US. Even for men, we're an outlier country. And this map shows you paid leave for new fathers. And, okay, so the US is the bright orange there. China is a bright orange. Fathers in China don't get paid leave, which may contribute to the persistence of inequality and gender inequality in China. Looks like Mongolia, a bunch of countries in Africa, but, like the quote, developed countries, Canada, Europe, Russia, Australia, all give at least 4 weeks to fathers, and many give more than that. Now, what about sick leave? Paid leave for a health problem, which would include short-term sick leave and long-term sick leave. And so this is from 0 weeks to 24 weeks or more for, like long-term disability. And of course, we have insurance for long-term disability, but most workers in the United States do not have it, especially the lower paid workers. So they just quit their jobs and they don't have an income. And, it's legendary how difficult it is to get on Social Security long-term disability. Just 26 countries offer 4 weeks or fewer in terms of health problems, but that's, again, what's being proposed in the expanded Paid Family Medical Leave Act. And we'll, if you have questions, I can see Alice looks really puzzled here, or she's just examining it. So if you have questions, we can go back to this slide if you want. So, in my opinion, it's a scandal. And there's all sorts of accompanying scandals. Like here, the question, how many days do survivors of domestic violence or sexual assault miss each year recovering from an attack or seeking assistance? It's astounding. 8 million paid days of work are lost every year to victims because of domestic violence. And of course, that loss is absorbed by the victims. Without access to paid sick and safe days, survivors are forced to risk their financial security or their jobs to ensure their own safety or the safety of their children. How much more likely is a person without sick leave to report to work sick? I could take guesses from the audience, but I'm going to tell you in the interest of time. 1.5 times more likely to go to work sick if you don't have paid sick leave. How much more likely are they to send their sick kid to school? Twice as likely as other people who have paid sick days. How much more likely to take a child or family member to the emergency room because they cannot take time off work? 5 times more likely. That's a lot, and that really contributes to people's medical debt. Because especially the people who don't have paid sick leave very often don't have paid health insurance either. So, what are the benefits? If we were to provide adequate paid sick and family leave in this country, What are some of the benefits? Well, business would benefit a great deal. One, productivity has been shown to increase among workers who have these benefits. Profitability thus would improve. Turnover would be diminished because people, it's again been shown that people who have good benefits, including paid family leave, don't quit. They don't want to leave it. Worker morale would improve. Worker morale certainly contributes to productivity and lack of turnover. And of course, worker health would improve, which could in fact lower insurance costs for employers who do provide health insurance. So, you know, for an employer who says, I cannot afford paid sick leave, I cannot afford to provide my employees with paid family leave, they're really just looking at the short term and not at the overall long-term benefits of it, which in fact can be a real benefit to their business. So how do we pay for it? Well, there's a lot of different proposals. And when Alice said that we have not landed on any one proposal, that's because we're wanting more research done to understand affordability, to understand need in the state of Missouri. And so the various proposals are, you know, like the employee, get the employer to pay for the whole thing. That's certainly much more common as a proposal for paid sick leave, less so for paid family leave, but certainly a number of employers pay for it. Or you can force your employees to pay for it by contributing monthly or biweekly in their wages as a wage deduction. Or you could share the cost. Or you could exempt the employer and the employee and pay through a tax system, which could be shared by them, like Social Security, or could be appropriated out of government without specifically taxing the worker. So there's lots of ways to do it. Colorado just passed paid family and medical leave for almost everybody who works, including gig workers. And that one is going to be paid for by a shared tax between both employers and employees. That's just an example. Excuse me. So I'm going to turn it back over to Alice, who is going to talk about the position statement, and then we can open it up for questions. Thank you.
So our position statement that we want you to review and get back to us, and it just went off my screen. So
oh, I'm sorry, I'll put it back. Sorry.
I think it basically says that we support family and medical leave for workers.
There.
Okay, we support paid leave for the health of workers and their families. And so that's the statement we want all the local leagues to review. And we know that league members and library subscribers all are thinking people, questioning people, and don't automatically come to conclusion without, you know, further information. So we don't expect you to jump on board today, but we would like to hear back from you. But now we can do questions and answers.
I don't yet see any questions. What do you think the general public should do? Is this something that they would want to contact? You said you're not seeking legislation, but is it something to write letters to the editor? Do you have suggestions for just the general public to promote this idea?
Well, I would say definitely your Congress people. And I know that Cori Bush did not vote for the infrastructure bill because it was missing this and a number of other important ingredients. Although it did pass and it's still out there. I would say yes, all of your House of Representatives and your senators would be people to talk to. And I also wanted to say, and I'm proud to share this with you all, but when I went on the national website for the League of Women Voters, they joined with a group of 340 other organizations representing a large demographic group of 40 states. They sent a letter, and this was when it was in a budget proposal in 2018. They sent a letter urging members to support an inclusive paid family and medical leave policy, and to reject alternatives that leave people behind. Specifically, the groups want to make clear that paternal leave only plan included in the administration's 2018 budget would do more harm than good and should not be considered a legitimate paid leave. And these groups were advocacy groups, direct service groups, organizations, and private sector. And I think that's a very strong statement in favor of a comprehensive bill.
Okay, we've gotten some questions now. The first one is, do we know how Missouri employers compare to the national statistics?
I can take that if you want. No, we don't. That's why we want to do the research. We certainly think that we have a hunch that Missouri is behind national statistics, at least of the more, how do I put it, employee-friendly states. I think we're really quite behind because there are a number of states who actually mandate this, but we don't know for sure. And so I saw that there was another question about what questions we are asking that we will have in a report that's going to come out next spring that are being researched. And let me tell you, we want to know how many workers in Missouri currently have paid sick leave. We want to know how many workers in Missouri currently have paid family leave. We want to know how many do not have either of these things. Of all categories, paid sick leave, paid family leave, no paid sick leave, no paid family leave, we want to know demographics, both in terms of the type of job and education and training for that job, the income level, the size of the employer, how many workers have children under 6, how many have unions, data broken down by gender, race, ethnicity, immigration status, how many of these have health insurance, what's the degree of absenteeism in both businesses that have and do not have paid leave, what's the loss of productivity from absenteeism from workers with no paid leave. And so you can see there's a few other questions. I'm not going to read every one of them. We have a lot of curiosity. We don't know if we're going to get answers to these because a lot of these things aren't really measured at a statewide level. And so we'll see what we get. But what we hope to get is enough of a profile to understand what kind of model would work for Missouri, and then try to figure out the politics of it.
And I would add, Judy, that in our study, there's an appendix that has the status in Missouri of paid leave. And so it shows that there are, I think, 6 executive branch offices that have paid leave, the auditor being by far the best. Kansas City, Missouri has a strong paid leave plan, and St. Louis County. So you can find that. And Lauren, maybe I should send you the total report and you can share it wherever.
Okay, thank you. I think you answered the next question, which is what research will come out of the study that was mentioned. And I think you gave us an idea of the inquiries you were making, unless you had more to say on that.
No, that's, I tried to cover that. Yeah.
Okay. We had a question here on describing the Colorado provisions and when it goes into effect.
Boy, I don't know if I remember that. Do you remember it, Alice?
Well, it's a year or two, because you have to put a lot of infrastructure in place to make it happen. And you have to have an employer set up. And that's the problem in some areas. The systems, payroll systems are not set up. So I think it's a couple years out, but it's very comprehensive. And the bad news is it took them 7 years or 10 years via.
Nine.
We just all groaned when we heard that. But it took a lot of work, and they were, the way they went about it was very impressive. They built a strong force, and it had no or little opposition from employers, which was shocking.
And part of the reason for that is perhaps that it's jointly funded between employer and employee through a payroll tax. But what's amazing is they're even allowing like contract workers and gig workers to buy into the program themselves. I don't know if they can afford it, but at least there is that option so that almost all workers will be covered by it.
What reasons are given for not supporting paid leave? I wonder.
Money.
Money.
But basically it's the small business reason, which we get for every kind of worker and benefit. Small businesses are like the go-to argument for raising the minimum wage, for providing more insurance, for just about everything that would help workers in this country. And the fact is that that they then ignore big employers by using that excuse. And, it's a trick. It's very often a trick because, very often the smallest of employers are exempted from many of these laws. And, Family Medical Leave Act is a big example of that. Like even the unpaid FMLA exempts most workers. Now I'm not advocating that, but, but then, they still use the small employer argument. So, big employers often provide this kind of stuff, except for your, like restaurant employers and people in the hotel industry and the retail industry. Those are the big outliers in the United States who do not provide these kinds of benefits. And many of them are huge corporations and they can well afford it.
There's a question here that Judy, maybe you can help answer. I'll start with it. It's about, have we made any presentation to the Chambers of Commerce? And what was their reaction? And we did meet with their key staff person of our chamber in Kansas City, which is very progressive, but we didn't get any further than that. Do you want to talk about the Civic Council?
Yeah, we also made a presentation to the leadership of the Civic Council and have to pursue that because they offered the possibility that they could actually do a survey among their members. Now, the Kansas City Civic Council is like the elite of business in Kansas City. It's the biggest employers and the, like the richest ones. So it'd be interesting to find out what those guys are doing, but we haven't really pursued that yet, but we'll be doing that. So they had an interest in it. And they also asked about small business. But
well, and the small business, they have the thinnest margin, and the big companies have huge margins and elasticity. On the other hand, Judy, the federal proposals, I know it's bouncing all over the place. What's in there isn't there a subsidy in the plan and a mandate?
Yes, there is a subsidy, especially it would even cover gig workers as far as I understand it. Now, I don't know. The FMLA covers very few workers. You have to work for a company to be covered by the FMLA. You have to work for a company that I think has at least 50 employees within a 75-mile radius. So that exempts a huge number of workers who aren't covered by FMLA. You also have to have worked at the place for a year. And there's some other requirement, I can't remember. But anyway, so I think this proposal would include many more workers because I know part of it would allow for workers whose employers do not already provide paid leave to apply to the Department of Treasury for coverage. So it looks like the federal government is going to cover it, but I haven't really been able to see the details of the proposal. But as I say, like it's been cut back to 4 weeks rather than 12 weeks. And I don't know what other things have been cut back in it. Clearly, whatever passes is going to be hopefully a step in the right direction that gets improved But very often, just like with the unpaid FMLA, people said that in 1993, that, okay, well, we'll get paid leave pretty soon,
Mm.
and it's now been 28 years since that law was passed, and now we're arguing about 4 weeks.
Judy, would you look at the question from Nancy, and I'll take the one from Winifred. The one from Winifred said, how do employers supply workers to fill the jobs of those who take paid leave? And I think I understand that. I'll take a stab at it. I worked at Children's Mercy Hospital as the social work director for 23 years. We had the elasticity to cover those positions. And so small businesses don't always have that, but what it means is the work that's not being done is done by others. But some places have to have 24-hour coverage, so they have to build it into their plan. And part of the problem is you have to have a business model that is humane and treats workers with respect and cares about them, because they are your precious, precious resource. Without strong workers who are maintained and retained and supported and respected, what kind of a work environment is that, and what kind of a product are you making, and how are you contributing to the well-being? But anyway, Judy, you want to take it?
No, that's absolutely true. I mean, I am a firm believer that if you can't provide for your workers in a livable way, if you can't provide a livable wage and benefits to your workers, you shouldn't be in business. Other countries, developed countries, manage to do that. And, when businesses complain that, well, we just can't afford to raise the minimum wage, or we just can't afford to pay such benefits. The fact is that if everybody is required to do it, you're not going to be at a competitive disadvantage to provide those things if they're required by law. The other thing is, we've seen a lot of strikes in the last, actually in the last few months, even though October got labeled Striketober. And the thing is, a lot of those strikes, starting with the Frito-Lay one, which was actually in September, I think, or August, they're about staffing. They're about the fact that lean production means that places are systemically understaffed. And so workers are required to work huge amounts of overtime, weekends, 7 days a week. I mean, the people at Kellogg's, which is on strike, have been complaining that, they can go 100 days without getting a day off. So, like employers, if we're going to require people to be able to take leave, then employers are going to have to change their staffing policies, which unionized workers are already pushing for. It's the workers who have no unions that don't have that kind of power to push their employers. And so what do we see they're doing? They're leaving in droves. They're saying, what do they call it? The great resignation that's going on right now, where workers are hoping to find better working conditions and better pay. And so, this is just a phenomenon that's going on in our society. We'll see how far it goes. But as far as the question about the unionization, let me read it again. Over the past 40 years, the percentage of Missouri workers in unions has dropped from about 30% to 15%. Yeah, it's actually less. It's like 11, I think, or 10 at this point. Well, I think what that means is we need legislation, because workers can't win those benefits. Most unionized workers, except in the construction industry, win benefits for paid leave policies, paid sick leave and paid family leave of some sort. May not be that good, but they get something. It's the non-union workers, and that sector of the economy has been growing. And so this means that passing legislation is even more important than it was 40 years ago. And so I'd say that we've got to find strategies to either win this at the federal level or the state level.
And I would add to the importance of unions and why I'm active in Judy is with Stand Up Kansas City is it's 15.
And Jobs with Justice.
And jobs with justice, but you have to have a union because that gives workers, it levels the playing field. And one of the women who talked to us, well, several in different settings, but one of them was pregnant, no maternity leave, no time off for a prenatal visit, no time off after delivery, had other children, no money coming in, no way to provide for family, to pay the rent, and get the follow-up medical care that's needed. And that's big debt, and that's big debt. And the model is designed that way. To be a fast food worker, you usually have 2 jobs or 3, and those employers don't care what the other employer is scheduling your time. So they're powerless, and without a union, they can't survive. So the union movement, and Judy inferred that it's a pivotal time because workers are in demand and they have more say-so than they've had in a long time. So, but paid leave is a part of it, and employers can step up. And I think the respect for workers is just key in our country. And I think the model of, you know, more growth and more money and more profit only benefits the billionaires. And now there's 748 billionaires, and then 2/3 of the economy are workers in the service industry. So it's a social justice issue.
I want to go back, if I can, to the question about what can people do? Because what people can do and what we think needs to happen in Missouri, and what we're trying to do by speaking to all the various branches of the leagues and other organizations, is create a climate whereby there is much more demand for state legislation, either through initiative or whatever, for a full boat of paid leave policies. And we recognize that we have a legislature that is not about to pass such legislation. We recognize that the initiative process is extremely expensive and takes a tremendous amount of volunteer work. We're trying to create the basis to be able to do that. And so what can you do? Talk to your neighbors, talk to your friends, write your legislators, and become much more active in promoting this issue. That's what I can say at this point. We don't have a strategy yet, but hopefully we will at some point.
I had another question on whether any of the restaurant or hotel chains that might provide paid leave do.
I don't know the answer to that, but in general, the hospitality industry, unless it's unionized, does not.
Judy, you want to talk about the tip problem?
Mhm.
How the tips?
Tips, oh, is that a question here?
No, but I'm
No.
adding it because it has to do with the service industry, and it's just another piece of the complexity.
Oh, well, you know, I mean, the Missouri minimum wage now is what, 12? No, it's not 12, it's 10 something.
No, I think
It's 11?
well, it's working its way to 12.
Yeah, it's working its way to 12, but it's not there yet. I think it's 11 something. But anyway, somebody can look it up on their phone real quick and tell us. But, you know, in Missouri, through the initiative process done by Jobs with Justice, we increased the tipped minimum wage to 50% of the regular minimum wage. And that's because the federal government hasn't raised the tip minimum wage since the early 1990s. And the tip minimum wage right now is $2.13 an hour, which is terrible and shameful. And there are organizations, national organizations, that are trying to get rid of the tipped minimum wage altogether. And because it's extremely discriminatory against servers, and it puts them at the mercy of being tipped in order to be able to earn a living wage. And there's tons of testimony about the accompanying sexual harassment for women servers, but even for men, because they have to basically perform in order to get their tips. And there are a number of people who are unscrupulous enough to see it that way. And so the tipped minimum, having a tipped minimum wage is inherently discriminatory against women and needs to be abolished. it's just another one of those issues that makes servers and any other tipped employees basically people with very unpredictable standards of living. And of course, they don't have paid family leave either.
Mhm.
Is that what you wanted, Alice?
Yeah, and Karen, thank you. It is $10.30 now,
Oh, okay.
and it will go to $11.05. And can you imagine making $10.30 and having
Yeah.
a family?
The tipping is an outgrowth of slavery, post-slavery era. Actually, if you study the history of tipping, you know, particularly like for food service.
Mhm.
So America's history is all bound up in things that are amazing that we still this many years later are having to deal with. But all of these factors, think about no health care, I mean, we have some health care now, some changes, but there's no automatic national health care system.
Right.
Paid leave, minimum wage, have to fight for everything. And then it seems, you know, that the initiative petitions seems to be a way in Missouri to accomplish any kind of change.
Mhm.
Is that seems to be where you have settled on?
It's very vulnerable. Every year, 10, 20 legislators put in bills to scrap it, hurt it, make it more difficult, more costly, more feeble approach. And so it's vulnerable. And in our league in Kansas City, we have identified somebody who is on the paid leave, the initiative petition committee that is studying it, but it, costs money to poll, and then it costs money. We have to get 350,000 signatures in Missouri to move anything, but even to do that, it costs what, a couple million dollars. So the league would be well advised to continue to monitor and support a strong citizen ballot initiative and prevent any of the attempts to cripple it.
Yeah, we do expect to see efforts to make initiative petitions much harder in the next legislative session. So we've had one suggestion, participate in Missouri redistricting. We are in that process right now in the state of Missouri, and actually across the country. And people can submit suggestions for redistricting online. And if you go to the league's website, you can find that place where you can actually submit testimony. Something that citizens can do. There was another question. If the small business owner seems to be always the response, does it make sense to scale the issue for them?
Well, no, I mean, I guess it depends on how small.
Mhm.
But, like if that's what the FMLA as it currently exists was aimed at doing, no, I would not support that because just too many workers are left out. And so probably I'd say it depends. But what about looking at some kind of subsidies for small businesses if they really need it, so that everybody can be covered? I mean, I don't think you should, like if you're a worker, you should be able to get the same kinds of fundamental benefits, whether you work for a small business or a large business. It's, what that ends up doing is discriminating against small businesses because people are going to go want to work for the big ones and so they don't get as much talent. And so let's try to level the playing field some.
Well, and I would add to that, and Linda, I appreciate the question. I am remembering that when we worked on the Affordable Care Act, that there was a piece in there, and we have navigators that help people, but there was a piece in there that was structured so that small businesses could create their own plans, and there were benefits for them. So it was cushioned in a way that it made it easier and quite attractive for them. So that model could be repeated, but it was especially aimed at that question.
Okay. Well, we have just a few minutes. I don't know if you wanted to have some closing thoughts or if there's any last questions. Otherwise, if you had some closing thought, we are so appreciative of your taking the time and sharing. This is such an important topic.
Well, I would just say that it is very timely, and it's an opportunity for us to educate men and community around us about the importance of this for our own well-being. And I know that without this, we are really much too focused on just profits and results rather than well-being and a civil society. So I would say, talk to your friends, your family members, and listen to their opposition, but it is affordable because we make choices and we're the ones that should be in the driver's seat.
And I just add, first off, thanks to Marilyn and Lauren and to the Columbia League for hosting this. But also we have a new revised fact sheet, which is somewhat changed from the fact sheet you may have already received. I'm not sure if it was sent out. So Lauren has offered to send that out to everybody as well. And it's a one-pager. It doesn't go into a great deal of detail, but it might be useful to you in talking about the issue.
That'd be great. Did you want to show it or?
I could show it if you want. Yeah, sure.
Sure. So people will know what to look for, maybe. Lauren said she will send it out to all the participants, people who have
So that's what it looks like.
attended this.
Yeah, basically, and it's just got, bullet points of, important things related to the issue of paid leave.
That's great. And, watch the news because this is in the news right now.
Yeah.
And the suggestion, contact our people in the Senate, Congress, about the importance of this. And we are very grateful for you for taking the time to present this information and for doing the research. And we'll look forward to the report that comes out of the university. Our next month's Lunch and Learn, which we co-sponsor again with the library, is on Tuesday, December 14th at noon, about Boone County, the analysis of data from Boone County Jail. And, we've been doing several programs on minority juvenile justice. And so that's kind of in that same vein, just keeping people focused on making our community better. So thank you, Judy and Alice and Lauren and the library, and see you next month at Lunch and Learn.
Thank you.
Thank you.
Bye.